Hello everyone. Today I am going to discuss about the most important topic of obstetrics, that is the maternal pelvis. And in this lecture I am going to discuss about the bones, joints and ligament. And the next part I will discuss about the landmarks and the diameters. And this maternal pelvis is termed as pelvic girdle because it creates a connection between the axial skeletal system with the appendicular skeletal system. So, the maternal pelvis is a gynecoid type of pelvis whose brim is round in structure, as you can see, and this pelvis is having two innominate bones or hip bones laterally, posteriorly with the sacrum and coccyx, and anteriorly with the symphysis pubis. Now, I will talk about the parts of two innominate bones or hip bones. Each hip bones consist of three parts: superiorly with the ilium, inferiorly with the ischium, and anteriorly with the pubic bone. Now, the parts of ilium. Ilium anteriorly has a depressed part termed as iliac fossa, and posteriorly you can see roughened area termed as iliac tuberosity. And the flared part is termed as ala of the ilium, and the rest of the part is termed as body of the ilium. Now, this ilium, there is a having a projection superiorly, and this projection is termed as iliac crest, which ends anteriorly in a blunt end, and the anterior, which is termed as anterior superior iliac spine, and again a blunt end is there, which is termed as anterior inferior iliac spine, as you can see. Now this iliac crest posteriorly ends up with the spine, which is termed as posterior superior iliac spine, and the next one is termed as posterior inferior iliac spine. Now, as you can see, there is a line laterally towards the ilium. So this is termed as arcuate line, which later on merge with the pectineal line to form the iliopectineal line. These are the parts of the ilium, and as you can see, the posterior inferior iliac spine ends up with a notch-like structure, which is termed as greater sciatic notch, from where the greatest nerve, that is the sciatic nerve, passes. Now, the parts of ischium. Ischium starts with the pointed end, that is the ischial spine, and the roughened portion posteriorly termed as body of the ischium, and anterior to that is the ramus of the ischium, and inferior to that is the ischial tuberosity, which helps us for sitting. And this inferior ramus later on merge with the ramus of the pubic bone. These are the parts of the ischium, and there is also from the ischial spine, which is having, as you can see, this is the ischial spine. It is having clinical importance during the stages of labor, which helps to examine the fetal head station of the fetal head. And there is another notch starting from the ischial spine. It is termed as lesser sciatic notch. As you can see, this is the lesser sciatic notch. The ramus and the pubic bone forms the opening termed as obturator foramen, which is covered by the obturator membrane through which the blood vessels and the nerve passes. The part of the pubic bone. Pubic bone starts from the pubic ramus, which is getting joined with the ramus of the ischium. So ramus of the inferior ramus of the pubic bone, then body of the pubic bone, and then pubic crest, and the projected portion is the pubic tubercle, and then the superior ramus of the pubic bone, and laterally to that is the pectineal line, which merges with the arcuate line, and pectineal line which merges with the arcuate line to make the iliopectineal line. Three bones together form a cup-like socket. Three bones like ilium, this is, then ischium, and the pubis formed a socket-like structure which is termed as the acetabulum, and from where the head of the femur gets attached. So these are the parts of the different bones, or the parts of the parts of the two innominate bones. Now I will talk about the parts of the sacrum and coccyx. So sacrum, as you can see, it is having a flattened portion superiorly termed as base, and a pointed structure inferiorly termed as apex of the sacrum. Anteriorly, the surface is smooth, containing holes, that is termed as foraminas or anterior foraminas. Posteriorly, there is roughened portion containing the posterior foraminas, which helps the spinal nerves to just go through it. And there is an anterior projection which is termed as sacral promontory, and laterally there are two flared parts termed as ala of the sacrum. And the foraminas which are present anteriorly, they are joined by some transverse lines. Posteriorly, there are some projected portions which is termed as sacral crest, and also the starting portion, there is two articulating structure, as you can see, two articulating structures which helps the lumbar vertebra to get joint. The sacral crest end up at the portion at the opening, which is the opening of the sacral canal, and it is termed as sacral hiatus. And this sacrum is made up of 5 fused vertebrae. Now I will talk about the coccyx, and this is fused by 4 vertebrae, and the part is superiorly it is having the body, and inferiorly it is having the apex, and anteriorly here also there is smoothen end, and posteriorly there is two structure, as you can see, these are termed as coccygeal cornua. So this is all about the 3 bones which the pelvis consists of, that is 2 innominate hip bones, sacrum and coccyx. Now I will talk about the joints. We all know that joints are the structures or the portions where two bones meet together, or joints help two bones to meet. So here, as you can see, the innominate bone, that is the part of the ilium, the part of the innominate bone ilium gets attached with the part of the sacral ala, making the largest or the strongest joint of the body, that is the sacroiliac joint, both sides. And posteriorly sacrum and coccyx, which join together by the sacrococcygeal joint, and two pubic bone gets joined together by a cartilaginous joint that is termed as symphysis pubis. Now, we all know that where joints are present, their ligament is also present. So, sacroiliac joint, to help the joint, there is the sacroiliac ligament, both side. And to help the sacrococcygeal joint, there is sacrococcygeal ligament. And to hold the symphysis pubis with the two pubic bone, there is interpubic ligament. And also there are two imaginary ligaments. As you can see, this is the sacrum, and this is the ischial tuberosity, and this is the ischial spine. So the measurement from the sacrum to the ischial spine, there is a imaginary ligament, that is sacrospinous ligament, and also there is a imaginary ligament from sacrum towards the ischial tuberosity. It is termed as sacrotuberous ligament, both sides. So these are all about the bones, joints and ligament.